today we are announcing some major actions to protect this important right for the residents of the state of Washington. We wish this was not the case, but we have to recognize that there are forces abroad in legislatures and courts across the United States to try to take this right away from the women of the state of Washington, and that will not stand. So we are going to express a united voice today about actions we're taking to protect that that emerging national conspiracy that exists to try to take this right away from Washington women. We are defending this right every day in every way, and the first thing I will talk about today is to make sure that we maintain the ability to have access to mifepristone in the state of Washington. We know that this is a safe drug. It has been available for over 2 decades. It has been in customary use, and it has served its purpose to protect the health and a woman's right of choice in the state of Washington. Despite that, there is a real threat that a Trump-appointed judge in Texas could take action which could jeopardize the ability of Washington women to have access to this safe drug. That decision by a court could effectively end the manufacturing and availability of that drug for manufacturers. So we are not sitting idly by while that threat exists. We recognize in Washington that the price of a woman's freedom of choice is eternal vigilance. And our vigilance has led us to take actions that I will talk about today to maintain access for Washington women to this important drug. So in order to address this emergent attack and access to effective health care, I have directed our State Department of Corrections to purchase a 3-year supply of mifepristone. It's about 30,000 doses. The department is able to make this purchase using existing statutory authority. The purchase has been made, the shipment has arrived, it is in our possession, and the department is appropriately maintaining that safe supply. This acquisition of a 3-year supply was step 1 in our effort, but it is only a step 1. Step 2 is to authorize the department to distribute this medication to healthcare facilities and healthcare providers. To achieve step 2, I've asked our friends in the legislature to authorize this, and we will have Senator Kaiser and Representative Bateman address that issue today moving forward. To be clear, the authority we are seeking today is limited to abortion medication and does not extend to any other type of medication. Washington State will not allow a judge in Texas to deny the right of Washington women to this safe drug. We will not sit idly by. We have to recognize these threats will continue, and our actions will continue to preserve the right of choice in the state of Washington.